What's going on? I finally splurged and hired a better looking actor than this guy right here to show us. Rochelle, what are we going to be doing today?
We're going to be showing the 3 spine stabilizing exercises that everyone should be doing every single day.
Okay, so let's just use a little bit of history. You've destroyed, I'm using the term very scientifically, but you've injured your back pretty good.
Yes, a few times.
Right, a few times. A couple herniated discs. And how have these exercises benefited you?
These have been the only exercises I've been able to do that has reduced the amount of pain and also protected my spine from it happening again.
Yeah, so go ahead and walk us through these 3 exercises.
Okay, so the first one that we're going to do, so you want to remember that through this whole thing, you're keeping your spine neutral and
Can you go on all fours and show us like what a non-neutral spine is and what a neutral spine is?
Okay.
Because this is a way to find out a neutral spine.
So this would be a neutral spine. You're keeping.
So you want the curves in the spine. So you can see, touch your lumbar curve. So this is the lumbar curve there. She won't be able to touch the curve in between her shoulders, but it's supposed to be the opposite of what the lumbar curve is. And then the curve in the neck and the lumbar curve are the same.
Yeah, so you don't want anything like this.
Yeah, so that's so go back to that position a little bit. So that's called hyperlordotic. You can see the curve in the lumbar spine is too much. Now reduce the curve altogether. So that is alordotic. We want one that is just right. It's kind of like Goldilocks and the 3 bears. You want to be just right with the porridge. So the goal is to make sure that you find that position first. The best way to know if you're in the right position is it's going to be a pain-free or pain-reduced position. So before Rochelle would start these exercises, she would make sure that her spine is in that pain-free neutral position. So what have you just done?
So right now, I'm going to be starting the first exercise, and I'm placing my hands just under the small of my back. So those hands are going to act like sensors, and as soon as you lose that lumbar curvature, you want to stop the exercise and reset and make sure that your spine is neutral. So you're sticking your hands underneath. This is a very small.
Are your hands on top of one another? Are they touching one another?
No, they're just kind of like side by side.
Okay.
So place them under. For this, so you don't want to be lifting your head up off the floor like this. You want to keep your neck neutral. You're going to be placing one leg down. This is also going to help your spine stay in neutral. So the goal of this is to hold for 10 seconds, and you want to repeat it 6 times.
Okay, hold. So what are we holding?
First is you're going to be bracing your core. So think about bearing down, like squeezing everything in the front really tight.
Squeezing like somebody's about to punch your stomach, right?
So squeeze everything really tight, and then just a slight lift.
And you hold that lift for 10 seconds.
And then back down. Okay? So you don't want to be doing any of this. It's just simply bracing and holding for 10 seconds. Okay?
Exercise number 1.
Number 1.
Exercise number 2.
So this one is going to be stabilization for the side, so the obliques.
Yep.
Okay. If you have any type of knee pain or ankle pain, there's modifications that you can do. So the first one is you're just going to be on your arm and your knees, or actually like this, and you're just going to lift up. You're going to be squeezing all this.
How long do you hold?
So 10 seconds again.
6 reps?
6 reps.
Okay.
You can do that on both sides.
Okay.
If you're finding that that's too easy, you can do a full side plank. So you're gonna put your feet down and lift. You can either hand, the point is squeezing this, lift up.
Now what if you're having some shoulder problems there with the arm that's down on the ground?
If you're having shoulder problems, you can go onto your elbow, and you can also squeeze this way.
And you can brace your arm with your other hand, right? Yeah, perfect. Okay, next.
The last one is called a bird dog.
This sounds like a blues musician. Have you heard of old Bird Dog Williams?
You're gonna come down on all fours.
Again, neutral spine.
Neutral spine, so nothing like this. Neutral spine. Same with this, you're gonna be holding each move for 10 seconds, 6 reps each. Opposite arm, opposite leg, you can have your thumb up, your foot's gonna be flexed. Holding it like that.
Notice how she did not break the neutral spine.
Like this. You want to keep everything flat. Okay, what you're gonna come back in like this, it resets the spine, and then you're gonna hold it again. Other side. And holding that for 10 seconds.
How often should I do these exercises?
So it depends how much your pain you're in. If you're in a lot of pain, you can reduce the time that you're holding these exercises and do it multiple times a day. But the goal is to do this once a day, holding each exercise for 10 seconds times 6 reps.
Okay.